How does glaucoma surgery affect the trabecular meshwork? Imagine your eye as a busy drainage system, where fluid needs to flow smoothly to keep your eye pressure healthy. The trabecular meshwork is a key part of this system, acting like a filter that helps drain the fluid called aqueous humor. When glaucoma develops, this drainage gets blocked or less efficient, causing pressure to build up and potentially damage the optic nerve. Glaucoma surgery aims to improve this drainage, but how exactly does it affect the trabecular meshwork? Many minimally invasive glaucoma surgeries, or MIGS, target the trabecular meshwork directly. Procedures like trabeculotomy or goniotomy involve making small incisions or removing a tiny part of the meshwork to reduce resistance to fluid flow. These surgeries are designed to open up the natural drainage pathway. Research shows that even after some of the meshwork is incised or removed, the remaining tissue usually doesn't cause problems like pigment buildup or scarring that could block fluid again. However, the body's healing response can sometimes lead to adhesions called peripheral anterior synecdoche, which are like tiny bridges that, from and can block the drainage angle, potentially reducing the long-term success of the surgery. Interestingly, the amount of meshwork removed or incised doesn't always correlate directly with how much the eye pressure drops, because resistance in the channels beyond the meshwork also plays a role. Sometimes, after surgery, pigment or membranes can form over the drainage channels, or damage to the outflow pathways can occur, which might cause the surgery to be less effective over time. Another approach is selective laser trabeculoplasty, or SLT. Instead of cutting or removing tissue, SLT uses laser energy to stimulate the trabecular meshwork. This stimulation encourages the meshwork to work more efficiently, helping fluid drain better. On average, SLT can lower pressure by about 20 to 30%. The effects may take up to 2 months to fully develop, and because it doesn't physically alter the tissue, it can be repeated if needed. Side effects are usually mild, such as temporary inflammation or a brief spike in eye pressure, but serious complications are rare. The laser treatment preserves the structure of the meshwork, keeping options open for future treatments if necessary. Some studies using advanced imaging techniques have shown that after these surgeries, there can be changes in the blood vessels around the trabecular meshwork. These vascular changes are still being studied, but they might reflect how the eye adapts to the new drainage conditions. Overall, surgeries that target the trabecular meshwork work by either physically opening or stimulating this natural drainage pathway. The success depends on how well the eye heals and how the outflow channels beyond the meshwork respond. It's important to remember that individual anatomy varies, and careful management during surgery can help maintain long-term drainage function. Patients should always work closely with their care professionals to monitor for any complications like adhesions or inflammation. In summary, glaucoma surgeries affect the trabecular meshwork by either removing or stimulating it to improve fluid outflow. While remnants of the meshwork after surgery usually don't cause problems, healing responses and resistance beyond the meshwork can influence how effective the treatment is. Laser treatments like SLT stimulate the meshwork without removing tissue, offering a safe, repeatable option. These procedures are part of a comprehensive approach to managing glaucoma, tailored to each person's unique eye anatomy and disease severity. Always consult with an eye care professional to determine the best treatment plan for your specific needs.